Welcome to another episode of Startup Health Now, the weekly show celebrating the healthcare transformers and changemakers reimagining healthcare. On today's special episode, supported by a grant from the Robert Wood Johnson Foundation to inspire entrepreneurs to focus on underserved communities, we're going to sit down with Inder Singh, the CEO of Kinsa, the world's first smart thermometer, and how it's going to change the way we look at the spread of illness all around the world. This is going to be a great episode.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. But I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say, be solved if we have the will, the courage. The future is to those who take it.
Welcome back to Startup Health Now. We're sitting down with Inder Singh, the CEO of Kinsa, the world's first smart thermometer. Welcome to the show.
Thanks, Steve. Thanks for having me.
This is an incredible product, and we've known each other for several years now. And I remember when you were telling me what this was going to do. So I'm really excited. Tell everybody what Kinsa is,
Sure.
And then I want to dig into the evolution and a little bit about your background, but the evolution of where you believe this is actually going.
Sure. So we make a product. We make what we like to call the world's smartest thermometer. It connects to your phone, and it does far more than an ordinary thermometer could do. But the reason we developed the product is rooted in a much broader mission. So Kinsa was started with a mission, with no product, with no business model. We were started with a mission to create the world's first real-time map of human health to track and to stop the spread of disease. And it sounds very, very grandiose. It is, but I'll just tell you a little bit about why we developed the product, and then we can dig in a little further. So we kept thinking to ourselves, in this age in which we have so much connectivity, I can't live without using Google Maps to tell me how to get downtown quickest, right? We have all this real-time information, all this sensory information. Even in this world, we're still in the dark ages when it comes to understanding the health situation around us, and that affects us directly. If you're a parent and you know that it's the common cold that's going around, you're probably not going to go to the doctor even when your child has, flu-like symptoms, sniffles. But if you know that strep throat's going around, you're probably going to go immediately, get those antibiotics, get that throat culture. So that's just a very small example of how this lack of information affects individuals. And at a system level, it affects the system in a much bigger way. So we kept thinking to ourselves, how can we begin communicating with someone who's just fallen ill to help them understand what to do next and get better faster, and at the same time gather data to map human health, to track the spread of disease in real time, and for the first time in history have an early warning signal that could allow the system to react and stop it.
And so that early warning signal being your temperature.
Yeah. The mantra, the early warning signal is a lot of the data that we gather through that product. So we not only gather geolocated fever data, we gather geolocated symptom data, we gather 7 sets of data that allow us to really understand what's going on in real time. All
right. So can you walk through the thermometer a little bit and show everybody what it is?
Sure. So so this is the packaging that we sell in Apple stores and consumer electronics stores. It sells for $29.99. We're really excited that it seems to be selling really well. We've been selling out of Apple stores across the country. The product itself, the first product, is a standard thermometer. It is a thermometer that you'd use under your tongue, under your arm, and even in a baby rectally. It connects via the headphone jack to your phone with or without an optional extension cord. And it sort of looks and feels like one of the thermometers that you would have in the doctor's office, where they have the big base and the cord, and they stick it in your mouth. This is one of the things that we're really excited about in terms of the design, is not only the internal design, but the external design. It's super flexible. It's more comfortable for kids. It doesn't have a battery. It'll never die. We're using the smartphone for a lot of its power processing, for its connectivity to the internet.
And any kind of smartphone right now?
It works on all iOS devices. devices, and it works on the most popular Android devices, so all the Samsungs, et cetera.
All right.
So cross-platform compatibility. Yeah.
Okay.
And it's sort of, to call it a thermometer undercuts the value of the product. So what you can do, with a few simple taps, not only have we gamified temperature taking so that it makes it easier to get a sick, fidgety child to stay still. And we love our Amazon reviews where moms are talking about how my daughter wants to take her temperature now because she gets to play the game while she's taking her temperature. So we've gamified it. But with a few simple taps, you can track your symptoms over time. You can add pictures of physical maladies. You can add medication information. So now when you go to the doctor, you have this full illness history, and they ask you, how did your or your child's illness start and progress? You pull your phone out right then.
Right. And when did it break? When did it start? The whole thing.
There's no questions. There's no remembering. There's no little scraps of paper that you've noted information down. It's all in your phone, which is always with you. So helpful for diagnosis. But it does much more than that. So a feature that we just rolled out last week is our groups feature. So now you can
groups.
Okay. So we have a simple name for it. Now you can go and check the health at your child's school. And if there's other parents that have joined that group, you get an anonymized, aggregated signal of what's going on. There's a little health card, and it tells you 5 out of 24 kids are ill. It says these symptoms are going around and these illnesses are going around. And there's this messaging feature that also facilitates instantaneous communication. So should I describe that?
Yeah, well, I want to hear that described because one of the things, I remember you talking about the vision a couple of years ago about population health and how when you start to look at a community, you can start to see what's happening without ever having to take a proactive approach. It just starts to show up.
That's
so
right.
You launched groups a couple weeks ago or a week
Correct.
ago.
Yeah.
Where have groups launched and what's been the impact even in the couple weeks you've been using it?
Yeah. So first, going back to our broader vision, right? We want to create this map of human health to track and stop the spread of disease, which we believe is one of the biggest problems in healthcare globally. Imagine a world in which we could stop the spread of disease. It would completely change healthcare in the world. And so, the other way that I like to articulate that is we're creating a health weather. We're creating a real-time understanding of what's going around and how it's going to affect you. Whether you're sick and you want to respond to an illness, or whether you're well and you want to avoid getting ill, it affects you in both ways. And so through our groups feature, we're seeing that vision finally come to life. We're really excited about it. So I'll give you a simple example. We launched groups about 3 weeks ago, and we launched it in a beta at 14 early educational centers, many of which were underserved communities, and rapidly saw very high usage at many of these schools, upwards of 20% at 6 schools within a couple weeks, which was great.
Fantastic.
20% of parents were using it. And at one school, there was this really cool thing that happened about 10 days into it. One of the parents sent a message out through the group and said, my child has rosy red cheeks and a spike in fever. This is at 3 a.m.
Right. Is this anonymous or people?
It's anonymous. So you can disclose who you are if you so choose, but by default, it's anonymous, right? So the idea here is preserve anonymity, but at the same time, give the group the information they need to respond. So it's creating that balance.
And everyone's automatically contributing the temperatures of their children in that case?
Correct. If you choose to opt in and see the health of the group, you are by default contributing to the group.
Okay.
So that's one of the requirements of seeing,
you can't see without contributing yourself.
There's a quid pro quo. Yeah, exactly.
Okay.
Yeah. And so what we saw is that someone messaged at 3 a.m. and she said, my child has rosy red cheeks and a spike in fever, not sure what it is. Shortly thereafter, middle of the night, someone responded and said, my child had the same symptoms. I took them into the doctor. The doctor said it was Fifth's disease, which is highly contagious, but there's nothing much you can do about it. You just got to get through it. So the first mom responded and said, so I don't need to take her to the urgent care facility, ? So it was perfect, right? It's an example of a little bit of context, giving you a little bit of information about what to do next, right? And this is not a diagnosis. It's not treated as a diagnosis, but it's a little bit of information that can help you react at your time of need. So we're really excited to see that sort of small bit of the health weather coming alive.
Right. So when you take that weather, you go from a little tiny, cluster of a school and you blow that out, a couple of years from now, where does this play out? So think about, and we could talk about underserved communities, we could talk about global health, but how does that end up rippling through everything?
Yeah. We're hopeful that in 10 years' time, we're the system that's informing the WHO and the CDC about where and when disease is spreading, right? Imagine tens of millions of thermometers all over the globe talking to each other and talking to the cloud, alerting people as to when fever and early symptoms that are early indicators of illness are occurring, right? It becomes this warning system. This is hugely important in our context today, right? With Ebola scares, with the issues around flu, vaccines not working. The spread of disease is a serious issue, and it continues to be a serious issue today. I like to use this example: seasonal flu, right? Yeah. Every year the flu happens. It occurs. We know it's going to happen. We have the tools to prevent it through vaccines. We have the tools to stop it and treat it through Tamiflu and other drugs. But it happens, and it affects 1 in 5 people globally. Every single year it happens. Can't we do a little bit better in terms of stopping it? The seasonal flu has arguably killed more people than most wars in history combined, right? It's a crazy stat. And yet we have the tools, but we're not stopping. It's because there's no early warning system, let alone HIV, TB, malaria, acute respiratory infections, pneumonia, and all these other communicable illnesses.
So early warning sign for all of this. You lit up, by the way, just so you know, with all that. And I think it's because you've seen this firsthand, and I think it'd be useful to kind of take a little step back from what you just described with how you got here and a little bit about your background, because this wasn't just a random idea from somebody about connecting a thermometer to the iPhone or the Android. It was actually built on your own experience.
Yeah. So I'll start with the personal thing that happened. So in 2011, I fell really ill. 2 antibiotic regimens didn't work. 8 days into it, I had 104-degree fever still. I was desperate. I started looking on social media. I was like, I have flu-like symptoms. Someone else has to have this. Maybe they can tell me how to get better. And so I went on and searched on Facebook, Twitter, Google, found nothing, found no context, found no information. Now, at the time, I eventually got better, but at the time I was working for the Clinton Foundation. I was leading part of the Clinton Health Access Initiative overseas, and my role was, working to make drugs and diagnostics widely accessible in the developing world for AIDS, malaria, TB. And so I spent my life thinking about how you curb the spread of disease, how you get drugs and diagnostics and preventative things out to the masses. And here I was suffering from, this spreading illness. So I was pretty well connected in the community. I got better eventually, but it was sort of a very personal situation that reflected my professional experience. At a personal level, it would have been great to know what's going around. At a professional level, I had already been growing frustrated that the world allocates hundreds of billions of dollars to stopping, curbing, preventing the spread of illness, and does so with terrible information about where and when it's spreading. How do you stop the spread of disease if you don't know where and when it's spreading?
And it's basically word of mouth right now.
It's word of mouth, I mean, there are labs out there that try to confirm an illness, and then they send that to the CDC, and the data is sparse, and it's 5 weeks late. By the time you confirm the case of severe flu, it spread to many other people.
Which Google came, had obviously been active at kind of using search and exposing where people are starting to search for these symptoms and issues, so they can actually show that where the outbreaks are occurring around the world.
Yeah, so Google Flu Trends, which is I think what you're talking about, as well as social media mining, huge leaps forward in thinking around how you track the spread of flu and other illnesses, right? They basically said, we're going to get data from people while they're still in their homes before they enter the healthcare system. And if you look at the literature, people don't enter the healthcare system for 2 to 3 days after they have severe symptoms. We're going to get it in the course of their everyday work, and we're going to mine their search queries, we're going to mine their posts to sort of understand where and when illness is spreading. Wonderful leap forward. We applaud those guys. We're super excited about the work they continue to do. The challenge is that it's not accurate enough. Right? So you got these problems with geolocation. Unless you have geolocation turned on, it's sort of regionally based. You've got these problems with natural language processing. Really simple examples of I'm searching for Bieber fever. It's clearly not indicative of fever or flu.
Do you have Bieber fever? Is that what's going
And the third is there's these secondary effects. If the New York Times writes an article on the flu, there's going to be a spike in Google search queries. So what we argued and what we asked people for years is, before we started Kinsa, is can we use some sensor data to get real-time, highly geolocated, medically accurate data taken in the context of someone who has just fallen ill. Because with that data, you can start normalizing the Google Flu Trends data to draw meaningful insight. And that was the missing ingredient. That's what we provide through this product. And that's why we set out to do this, is to take the next step above and beyond what people had already made.
So you kind of led, is this your first time being an entrepreneur?
I've been through a bunch of startups, but this is the first time I've been building a venture-backed company. Yeah, absolutely.
Right. So in thinking about the product, so your Clinton Initiative experience, developing countries, underserved communities, clearly you had to think differently about this product than I think a lot of other organizations might think about their product. Even the large consumer packaged goods or consumer-focused brands that put thermometers out in the market. You thought about this differently from the beginning.
That's right.
And I know your dream is to drive down the cost so that it's actually accessible to everybody around the world. Talk a little bit about how you designed for impact to underserved communities in developing world, because I know that was probably among the biggest challenges you had in developing this and getting it out to market.
Absolutely. I come from a background in running access programs. And when you think about widespread access, the first thing you ought to think about is cost. Like, how are you going to drive that cost of that product down so it truly is widely accessible? Whether it's bought by governments or consumers, it doesn't matter. Cost matters when it comes to access. And so when we were thinking about this product, the question is, how do we get to a model whereby we can give away a medically essential product? And I would argue our thermometer is much more than a thermometer, and it's much more medically essential than an ordinary thermometer. How do we get to a point where we can give that away in tens of millions of units, but still grow the company and have revenue that will allow us to scale globally? And so when we started building this product, that was the thought in mind. And our goal in 10 years is to do just this. Again, this is a simpler thermometer than what you would find in most electronic thermometers. There's no battery. We draw all of that from the smartphone. So we draw power, processing, connectivity from here. And the goal is, in 10 years, again, to be able to hopefully be able to give this away for free while we make money in other areas. So I can provide some examples.
So the cost is one piece.
Yes.
What else about the design did you have to think about?
Yeah, cost is one piece. Cross-platform compatibility. So how can you make this ubiquitous? And so that's why we chose the headphone jack. So the headphone jack is the most ubiquitous port, and in doing so, we can connect to smartphones, and eventually we can even connect to feature phones. If you talk to the big telcos in the world, they'll tell you that even the feature phones are going to be starting to use like Android operating systems. They're going to become smarter over time. So that becomes an opportunity for us to sort of make this much more widely spread and accessible. So cost is one component. Ubiquity and thinking about how it fits into a broader marketplace context is really important. Making sure that it also is a better product despite those two limitations, those two constraints, is really important.
In fact, on that one, what other products do you compete with out there? Not only what are clearly the electronic thermometers that everybody has in their medicine cabinet, but what does the market look like around other smart thermometers or people that might think they have smart thermometers in their pocket?
Yeah, when we started, there weren't any. We started, so in the thermometer category, there are the stick thermometers. You put them under your mouth, under your tongue, under your arm. There's also the infrared ear thermometers, which are higher end, much more expensive products, the non-contact things. They both use infrared technology there. That was the state of the art for 3-4 decades, whatever it was. And when we started, no one was building a smart thermometer. No one is using the thermometer as an entry point to communicate with the ill, because ultimately, the really brilliant idea behind this is not that we're getting geolocated fever data. The ultimate sort of the real brilliant idea is that we're using this and piggybacking off a very common behavior, a parent taking a child's temperature, to begin communicating with the ill, to be able to help guide them and to be able to gather data. It's piggybacking off that behavior. That's the real idea here. So no one was doing that. No one was building a connected thermometer. We raised our Series A, and now we found 4 Kickstarter campaigns around connected thermometers since our Series A. And so people are now starting to build them. They're starting to build very high-end products with bells and whistles that have these beautiful designs. We think our product's got a really beautiful design, but it's lower cost. One of my frustrations when I think about all these new smart devices in the world, whether they're fitness devices or whether healthcare devices, is they're built with all these bells and whistles. They're built with these beautiful industrial designs, but are they really built with the ultimate value to the user in mind. What's the connected value? Right?
Yep.
These hardware products will all get commoditized over time, right? And what the value is going to be in the connectivity and the other aspects. It's the software aspects of it that give these products the value.
Right. So underneath that, the accessibility is really the
critical.
idea that it's not about having premium thermometers out in the market that just, the middle class and wealthy people can afford, but actually getting it into the hands of everybody.
Yes.
Who could be utilizing it and contributing.
And let's extend that. If you can do it, if you can actually get it out there in mass quantities, you now have other business models. You don't need to make money off the hardware. You could probably make money off of creating value in the world in other ways, and massive value, right? In our case, it's tracking the spread of disease and being able to inform society about that. It is creating this health weather concept. The weather as a business, weather data is $1 billion business.
Yeah.
They sell data. I mean, here we're creating a new kind of data set that news agencies can sell. So you're accessing greater, bigger business models, and you're potentially allowing people to get the core product, at a very accessible price, and scale fast.
So when you think about, the company, is it more about the product, the data? I don't know it's going to be everything, but what when you prioritize it a little bit, is it about more the product piece out or the data and the analytics and what can come from that?
We have no shot at realizing our mission unless we build a better product, unless we build a better widget. We have no shot at it. So for today, it's the product. In the long term, we're guided by this mission orientation, and I'm grateful that the people we've hired are very aligned with that mission. But good intentions don't matter in the real world. They don't matter. And so you've got to design the product in a way that is meeting your mission objectives, but also meeting the market. And that's a challenge, right? When we think about product design, as you've sort of alluded to, we think about two audiences. The audience of moms and dads who are power users of thermometers. What do they want? What will add value in their lives? And what's really high value? Not modest value, not just a cooler design, but really fundamentally new value. And the way I like to articulate it is what's the connected value of the product, right? And so in here, it's that group context, right? It is the ability to be able to understand trends in the local area. It is the ability to store and visualize full history so you don't have to write that stuff down. Those are the two pieces that we know are really valuable to begin with. And then the third piece is making it easier to take a kid's temperature because you've gamified it, right?
Yep.
So that's the connected or appified value. But then each feature is subject to the mission value. Like, how is this contributing to the mission? And if it's not, we probably won't prioritize that feature. So it's a balancing act. And I think, consumer companies have a hard enough time building beautiful products that delight users. We've got an extra level of risk in our business model, if you will.
Right.
So.
And it's now in Apple stores, right?
It's in Apple stores. It's in CVS. It's at Amazon. We'll be rolling it out into a couple other channels soon, and we'll be launching a second product in 5 months in an ear thermometer.
Oh, fantastic! So another product is going to add to the data matrix.
Yeah.
I want to go backstage a little bit at Kinsa and talk about your entrepreneurial challenges and some of the things that you've learned over the last couple of years. Both what challenges have emerged that you didn't see coming, or maybe you did and you just didn't, perhaps underestimate it. But I want to kind of get real a little bit about the entrepreneur side of this.
Sure. The two biggest challenges we faced is one is very common to tech companies that are building new kinds of products, and the other is frankly the challenge that any company has. The first is finding the right people. We're a peculiar company because we're mission driven. We're very mission driven, and we not only need to find experts in sales and marketing and digital, conversions and supply chain and regulatory, but we need those people to truly believe in the long-term vision. And that's not always the easiest thing to find, is that intersection of great talent and culture, right? Cultural fit. And I think that's a challenge for any company. I think we're peculiar, and maybe it's, I would argue, it's perhaps more attractive to most people, but let's see. The second, and any company has the challenge of finding people in a timely way to grow the company. Just the good people that fit the culture in a timely manner.
Are they all here in New York?
Currently they are. Many of them are here in New York. Most of them are here. We do have some advisors and consultants that are experts in their field that are virtual. We are opening up San Francisco operations in a couple months. And then the second biggest challenge, I would argue, has to do with these new kinds of products. When they're brand new, telling the story is hard. right? When you walk into a pharmacy, in our case, and you want a thermometer, you're usually sick or your child is sick, and you want to get old familiar, something you know is going to work and is going to get the job done. And so being able to sell a smart thermometer at that point is a difficult sell, right? Because you're trying to sell somebody at a point of need when all they want to do is get in and get out, right? Or they may have their sick child and they're lugging them around and they're just going to grab what they need. So building the brand is really important to us. The design around the product, the design around the packaging, the design around the logo, the name, everything is really, really critical to sort of building that brand. And so I think one of the mistakes we made is we didn't start thinking about that stuff early enough. I think had we started thinking about it 6 months earlier, we would have been even bigger than we are today. And we're doing well. We're getting lucky because people love the product. But that would have been.
But you would have started sooner.
Absolutely.
And were you waiting to accomplish certain things before you started thinking about that?
We didn't. I guess in our case, we didn't really have a choice because we were dealing with like, how do you get the FDA to approve a product where it has a lot of software on it, not just medical software, but non-medical software. How are you going to get them comfortable with doing iterative development on a medical device, iterative software development on medical? So there's a lot of challenges.
How hard was that?
If you talk to almost anyone who works on medical devices at big companies, they will tell you there's no way the FDA is going to approve a product where you're doing iterative software development. You're going to have to test every single time you make an update. And, I think we have designed it in a really great way that allows us to separate the medical from the non-medical. And regulators seem to be very comfortable with the approach. So we were really proud of that. But there was a lot of challenge at the time. There's less challenge now that the FDA has sort of come out with some additional
They're learning
guidance.
about the Internet of Things. Right. I think is going to change their job significantly.
Absolutely.
Right. So no people coming out with products like this. So what other challenges or lessons have you learned along the way? And maybe we can zero in a little bit about come back to the design issues we're talking about. I want to make sure that entrepreneurs thinking about building businesses or they have businesses that are focused on serving underserved communities or developing countries, what would you want to tell them? And a lesson like we would have started thinking about the brand earlier and some of these other things. What other things would you tell them that are critical to think about as they evolve their business from perhaps an idea or perhaps very early stage?
One, good intentions are not good enough. Don't just sort of start with a mission and think that everyone's going to join the game and do it. You've got to build a product and design a product that people truly, truly love. Two is access is critical, and when you think about access, you have to think about at least two things. One is cost. Cost has to be low, and I went to MIT for grad school, and I had done a bunch of developing world stuff before this, and I loved talking into the media lab at MIT. They'd come up with all these brilliant ideas about how they're going to change the world, and it was so refreshing to see all this innovation. The first two questions I would always ask those guys is, what's the cost of the product, and who's going to maintain it? Right? Who in the developing world is going to maintain this product, who's going to update the software so that these products just don't get tossed on the side? Anecdote, Africa is riddled with technologies that people had great intentions. They, plants and factories and this and that, and there's a lot of technology that's just tossed by the wayside because there's no thought about how you're going to sustain it. There's no thought about how you're going to actually update it and upgrade it and maintain it. The technical skills. That's changing now. That's changing now in a heavy way. But back 10, 15 years ago, you really need to think about those two things: who's going to maintain it, and what is the cost. Third is how you're going to get it out to the market. I think that's why software apps are great because distribution is easy.
Yep.
But how are you going to get it out to the market, and how are you going to build towards that? People have asked me with regard to our product, can this get out to rural Kenya? I don't know if we can get this out to rural Kenya, but I can bet we can get it out to Nairobi and Cape Town and Johannesburg and Shanghai and Delhi, and so that creates the impact that we need to sort of have that global sensing opportunity. Is that helpful?
Yeah, no, it is, and if let's go into the underserved community challenge a little bit here, which is how do you get this into underserved communities and widely spread through either, programs, word of mouth, or what are you doing to actually make sure that, when you talk about a school, the way you just described the situation a few weeks ago at that one school that has it infiltrating. You said 20% of the school already using it.
Yep. And it's a low-income school as well.
What's the do you have a program? And what if someone is listening and they want to bring this to their community or a community they know about?
Yeah.
How do we get this from where it is today and however many users? How many people have Kinsa?
We have about users of the app and the thermometer in the 80,000 range, which we're really excited about.
So how do you 10x it?
Yeah, how do you 10x it? It's a phased approach, which is you've got to build it. To me, it's very simple. You got to build a brand that people love. It doesn't matter if they're low income or high income. You got to build a brand that people love.
Do you think it matters in underserved communities?
Absolutely, 100,000% it matters. Absolutely, people want the cool new gadget, the fun gadget, the gadget that works, that adds value to their life. It's less important as to you absolutely have to build a brand and a product that people love. Period. Whether you're targeting a particular audience or not, it's got to be something they love. So for us, it's build the brand, build the product, and then once the brand is building, and in parallel to the brand being built, find the partners who are going to get to those communities easiest. You can only do so much as a company, right? And for us, we've got to build this product in a beautiful, elegant way. And even though many of us have backgrounds working with underserved communities on global health issues, on public health issues, we have to figure out where we focus first, second, and third. And if we found a distribution partner, Population Services International in Africa, I don't know who it would be here in the U.S. I've less experience working in the U.S. on these kinds of communities. But if we found someone who was willing to sort of help us get the product out there to low-income communities, we'd be thrilled. There's all sorts of challenges in terms of differential pricing, et cetera, and trying to think through those. But there's models out there that work, and we're familiar with them. But we right now need to focus on first things first. Build a beautiful product that people love. Only then will we get a shot at expanding the mission, and only then will we get a shot at giving it to, getting it out to underserved communities to make sure they have value. First steps first. Focus is really important.
Love it. So as we wrap up, I want to touch on a couple things. Wave a magic wand a decade from now. What does the world look like as a result of Kinsa?
Yeah, the world is, there's tens of millions of thermometers and other connected health products out there that are doing both real-time sensing for population level health, but also real-time communication. So somebody has a change in health status. They're immediately connected with the care that they need, the services that they need. Direct them to the doctor in the local village or talk to the doctor over their phone immediately. So real-time sensing, real-time communication with patients. We have an early warning system that allows us to understand where epidemics are spreading. When seasonal flu has started, in a hyper-local basis, health agencies are alerted and they can respond. And perhaps most profoundly, we're giving away the product for free. We're giving away the product and we're making money because we're adding and creating value for the individual and for the system. And that's the way we sort of monetize the business in the long term. That's the vision. And I think the last point is I hope that we have a group of like 50 analysts that are sitting there looking at all these trends and immediately sort of communicating with the CDC and the WHO so that we can actually use technology in a profound way to support these institutions that are critical to public health.
Fantastic. Well, this has been great. I want to ask one last question, sure. Which is, what are your indispensable tools you use as an entrepreneur to get to manage your business and get through your day? What are the 2 or 3 things that you find to be the most impactful for you?
That's interesting. I would argue it's not about the tools. It's about how you use them, and it's about focus. So number one, focus. Forget all the stuff that's going to come at you that is not core to the next milestone. Forget it. Just focus. Make sure that you have, if you're trying to do something as complex as having a massive impact on society, but using a product to get there, because you've got these 2 levels of risk, these 2 phases, you really need to have some really robust decision-making frameworks and some processes in place that allow you to think through things. It's really about effective management, effective process, effective decision-making frameworks. I do think that there's tools there that support them, but tools and frameworks are only as good as you use them.
I brought it out to strategic thinking tools, strategic, thinking that you do. It's obviously, all good reminders about the number of distractions that get, an
So
entrepreneur
many
goes through. Not
distractions.
only immediate distractions, but distractions about the future, which you can't control, and really don't matter if you don't hit the early stuff. So it's been fantastic. Inder, fantastic work over the last couple of years to watch this grow and become reality. Excited to see the next couple of years you continue executing, and really excited to see the results of more schools and more places and more underserved communities and more developing worlds using something as impactful as this to stop the spread of disease. So thanks for joining us, and thanks for joining this episode of Startup Health Now. You can find all Startup Health Now episodes, including this one, at startuphealth.com/now. Thank you very much for joining.